Have you ever had that stubborn, deep ache on the outside of your hip that just will not go away? Well, if that sounds familiar, you're in the right place. We are going to break down exactly what Greater Trochanteric Pain Syndrome, or GTPS, is all about, and more importantly, what you can actually do about it. Okay, let's jump right in.
So let's get right to the heart of it. What is that nagging, maybe even burning pain that you feel in the side of your hip? You know the one. It might be worse at night or when you stand up from a chair. It's a very specific kind of pain, and believe me, if you're feeling it, you are definitely not alone.
This picture here, it pinpoints the exact spot we're talking about, that outer bony part of the hip. The pain right there can be so frustrating because it messes with so many simple everyday movements. So let's actually unpack what's going on under the surface.
All right, first things first, let's make sure we're on the same page. In this first part, we're going to run through the classic symptoms of GTPS. See how many of these sound a little too familiar to you?
So does any of this ring a bell? That pain when you're lying on your side at night? That is a huge one for so many people. Or maybe it's climbing stairs, walking, or even just getting up after sitting for a while that triggers it. And that little wince of pain when you have to stand on one leg to put your pants on? Yep, that's a classic sign. So who does this tend to affect? Well, as you can see, it's actually pretty common, hitting about 10 to 25% of people. But look at this. It's way more common in women, especially between the ages of 40 and 60. And here's something really interesting. There's a super strong link with low back pain. A lot of times, issues in our back change how we move, which can force our hip muscles to work overtime, and that can lead right to this kind of irritation.
Okay, so we know what it feels like and who tends to get it. But what is actually happening inside your hip to cause all this grief? Well, our understanding of this has changed a whole lot over the years. For years, doctors just called this pain Trochanteric Bursitis. The idea was that a little fluid-filled sac, the bursa, was inflamed. But you know what? The latest research gives us a much clearer picture. We now call it GTPS because we understand the root cause isn't usually the bursa at all. It's actually a repetitive strain injury to the buttock muscles and their tendons. So really, it's a tendon problem. This diagram is fantastic because it shows us exactly what's going on. You see that gluteus medius muscle? Its tendons wrap around and attach right onto that bony part of your hip, the greater trochanter. GTPS is what happens when these tendons just get overloaded and really irritated.
So what causes this overload? Well, it's almost always a mix of things. Maybe you suddenly decided to start walking 5 miles a day. Or it could be little daily habits you don't even think about, like always standing with your weight hitched onto one hip, or crossing your legs, or sinking into a super low couch. All these things can compress and annoy those tendons day after day. And this, right here, brings us to the vicious cycle that keeps the pain around. It usually starts with a little muscle weakness. That weakness causes the tendons to get overloaded and irritated, which of course creates pain. So what do? Naturally, you start using that hip less. But that lack of use, it just makes the muscles even weaker, which leads to, you guessed it, more overload and more pain. Breaking this cycle is the absolute key to getting better.
All right, that's enough about the problem, don't you think? Let's talk about the solution. Because the good news is you can absolutely break that cycle. This next part is all about the core principles for healing and getting you back on your feet completely pain-free.
Okay, first things first, let's just set our expectations right. Healing from a tendon issue like this takes time. Seriously, we're not talking about a few days or weeks. On average, it can take 6 to 9 months to really recover and build back that strength. So patience is going to be your best friend on this journey.
Now, this is so important to understand. You cannot just rest your way out of GTPS. It doesn't work. While you do need to back off from things that cause a major flare-up, just sitting around doing nothing can actually make the muscles weaker and feed right back into that pain cycle we talked about. Recovery has to be an active process.
So how in the world do you stay active without making things worse? The secret is something called the pacing and spacing method. It's all about finding your baseline. You know, the amount of activity you can do without causing a big flare-up. Then, from there, you slowly, gradually, and patiently start to increase what you're doing. It's about being smart, not just trying to tough it out.
Now let's talk about how you can apply this to your daily life. We're going to cover some simple, super practical changes you can make, like today, to reduce the strain on your hip and give it a real chance to heal.
I want you to think about how you sit and stand. Are you a leg crosser, or do you tend to hang all your weight on one hip when you're standing and lying? These super common habits are constantly compressing those gluteal tendons. The fix is pretty simple. Try to sit with your feet flat on the floor, avoid those really low sofas, and when you're standing, try to balance your weight evenly on both feet.
Nighttime can be the absolute worst for GTPS, right? The key is to take the pressure off. Rule number 1, don't lie on the painful side. Obvious, but important. If you're a back sleeper, putting a pillow under your knees helps a lot. And if you're a side sleeper, lie on your good side and stick a nice thick pillow between your knees and ankles. This stops your top hip from dropping down and pinching those tendons. We've talked about what to avoid. Now, let's get to the most important part of the solution. This is, without a doubt, the single most effective thing you can do to beat GTPs for good.
And there you have it, plain and simple. Strengthening the muscles around your hip, especially those gluteal muscles, is the #1 most effective treatment. This is how you break the pain cycle. See, stronger muscles give better support to the hip joint, and that takes the load off those angry, irritated tendons.
Okay, let's look at a great exercise to start with, the bridge. You just lie on your back with your knees bent. Then, you squeeze your buttock muscles and lift your hips up off the floor. Don't go too high. You're just looking for a straight line from your shoulders to your knees. Hold it for about 3 to 5 seconds and aim for around 10 reps.
Here is another awesome one you can do lying down. You take a belt or a resistance band and put it around your thighs, just above your knees. Now all you do is gently push your knees apart into the band, just enough to feel some tension. It's a static hold, so no big movement. Hold that for about 10 to 20 seconds and repeat that 5 times.
This one's great because you can do it pretty much anywhere. You stand with your feet a little wider than your hips, and you just imagine you're trying to slide your feet apart on the floor. You're not actually moving them. You're just creating a gentle tension in those outer hip muscles. Again, hold that for 10 to 20 seconds and try to do 5 repetitions. Now this is the million-dollar question, isn't it? I know what you're thinking. It hurts. Should I really be exercising at all? And that is a totally valid concern. Luckily, there's a really simple rule of thumb to help you do this safely. This is your guide. I want you to think of your pain on a scale from 0 to 10. It is perfectly okay to feel some discomfort while you're exercising. Just aim to keep it in that mild to moderate zone, around a 4 or a 5. But here's the most important part. That pain should calm down and settle back to its normal level within about 30 minutes of you finishing. That's your signal that you did it right. You're loading the tendon just enough to make it stronger without making it angrier. So the big takeaway here is this. You have the power to change this. It's not about waiting around for the pain to go away. It's about actively and smartly strengthening your way out of it.